Hello everyone and welcome back to my channel. In this video, I will be discussing about Rituximab drug classification and their use and side effects. I will also be sharing some tips for preventing and managing while the period for use of the treatment plan. I hope that this video is helpful for anyone who want to know or is interested in learning more about this common fact for Rituximab. Rituximab is a prescription medication used to treat certain types of cancer, such as non-Hodgkin's lymphoma and chronic lymphocytic leukemia. It is also used to treat certain autoimmune diseases, such as rheumatoid arthritis and granulomatosis with polyangiitis. Rituximab works by targeting and destroying specific cells in the body that are contributing to the disease process. It is usually given through intravenous infusion in a medical setting. Rituximab is classified as a monoclonal antibody. Monoclonal antibodies are a type of targeted therapy that works by targeting specific proteins on the surface of cancer cells or immune cells. Rituximab is typically manufactured according to the standards set by the United States Pharmacopoeia (USP) or the European Pharmacopoeia (PHARMA). These pharmacopoeias establish guidelines and standards for the quality, purity, and strength of pharmaceutical products to ensure they are safe and effective for use. Manufacturing Rituximab in compliance with pharmacopoeial standards helps ensure its quality, consistency, and safety for patients undergoing. Rituximab was developed by IDEC Pharmaceuticals, now known as Biogen, and Genentech, and was first approved by the U.S. Food and Drug Administration (FDA) in 1997 for the treatment of non-Hodgkin's lymphoma. It was later approved for other indications such as chronic lymphocytic leukemia, rheumatoid arthritis, and other autoimmune diseases. A bioequivalence study is a type of clinical trial conducted to demonstrate that a generic version of a drug is pharmacokinetically equivalent to the brand name drug. In the case of Rituximab, which is a biologic rather than a traditional small molecule drug, the concept of bioequivalence is replaced by biosimilarity. Biosimilarity refers to the similarity between a biosimilar product and an already approved reference product in terms of quality, safety, and efficacy. The biosimilar product should demonstrate that it is highly similar to the reference product in terms of structure, function, pharmacokinetics, and pharmacodynamics, with no clinically meaningful differences in safety and effectiveness. Before a biosimilar version of Rituximab can be approved for use, rigorous comparative studies, including pharmacokinetic and pharmacodynamic studies, as well as clinical trials in patients, are conducted to establish biosimilarity. These studies help ensure that the biosimilar product is equivalent to the reference product in terms of efficacy and safety. Overall, bioequivalence studies for generic small molecule drugs and biosimilarity. Studies for biosimilar products are essential in demonstrating the comparability and safety of generic or biosimilar versions of Rituximab for use in clinical practice. Biosimilars of Rituximab are approved based on demonstrating biosimilarity to the reference product, original product, meaning they are highly similar in terms of structure, function, pharmacokinetics, and pharmacodynamics, with no clinically meaningful differences in safety and efficacy. While biosimilars are not exact copies of the reference product, they are expected to have similar clinical outcomes. Numerous studies have shown that biosimilars of Rituximab have comparable efficacy and safety profiles to the reference product. Clinical trials conducted to support the approval of Rituximab biosimilars have demonstrated similar response rates, progression-free survival, overall survival, and safety profiles compared to the reference product. It is important to note that while biosimilars of Rituximab have proven to be highly similar to the reference product in terms of efficacy and safety, individual patient responses can vary. Patients who are switched from the reference product to a biosimilar or vice versa should be monitored closely for any changes in response or adverse effects. Overall, Rituximab biosimilars offer a more cost-effective alternative for patients while maintaining similar efficacy and safety profiles to the reference product. Patients considering treatment with a Rituximab biosimilar should discuss the options with their healthcare provider to determine the most appropriate choice based on their individual needs and circumstances. Rituximab can cause some common side effects. These may include 1. Infusion reactions. Symptoms may include fever, chills, itching, rash, nausea, headache, and difficulty breathing. These reactions usually occur during the infusion and are more common with the first infusion. 2. Infections. Rituximab can affect your immune system and increase the risk of infections. You may be more susceptible to bacterial, viral, or fungal infections. 3. Low blood cell counts. Rituximab can cause a drop in your red blood cells, white blood cells, and platelets, which may lead to anemia, increased risk of infections, and easy bruising or bleeding. 4. Fatigue. Many people experience fatigue or weakness during and after treatment with rituximab. 5. Nausea and vomiting. These gastrointestinal symptoms may occur as a side effect of rituximab. 6. Muscle and joint pain. Some people may experience muscle or joint pain after receiving rituximab. It's important to discuss any concerns or potential side effects with your healthcare provider before starting treatment with rituximab. They can provide you with more information and guidance on how to manage any side effects that may occur. Infusion reactions are a potential side effect of rituximab treatment. Some signs and symptoms of infusion reactions may include 1. Fever or chills. 2. Itching or rash. 3. Nausea or vomiting. 4. Headache. 5. Dizziness. 6. Shortness of breath or wheezing. 7. Flushing or redness of the skin. 8. Swelling of the face, lips, tongue, or throat. 9. Chest pain or tightness. 10. Low blood pressure. If you experience any of these symptoms during or shortly after receiving a rituximab infusion, it's important to notify your healthcare provider immediately. Infusion reactions can range from mild to severe, and prompt medical attention may be necessary to manage the symptoms effectively. Your healthcare provider may adjust your infusion rate, provide medications to alleviate the symptoms, or discontinue the infusion if needed. Here are some tips to help you prepare for your rituximab infusions and manage any potential infusion reactions. 1. Talk to your healthcare provider, discuss any concerns or anxieties you may have about the treatment, including potential side effects, and ask any questions you have about the infusion process. 2. Stay hydrated. Drink plenty of water before your infusion to help keep your veins hydrated and make it easier to access them for the infusion. 3. Dress comfortably. Wear loose and comfortable clothing to your infusion appointment, as you may be sitting for an extended period during the infusion. 4. Bring a support person. Consider having a friend or family member accompany you to the infusion appointment for emotional support and assistance, if needed. 5. Pack a bag. Bring items to keep yourself comfortable during the infusion, such as a blanket, headphones, a book or magazine, snacks, and water. 6. Follow pre-medication instructions. Your healthcare provider may recommend taking medications before the infusion to help prevent or minimize infusion reactions. Follow their instructions carefully. 7. Monitor for symptoms. Pay attention to any signs or symptoms of infusion reactions during the infusion, and notify the healthcare provider immediately if you experience any. 8. Rest and recover. Plan to rest and take it easy after the infusion, as you may feel tired or weak. Allow yourself time to recover and avoid strenuous activities. Remember that your healthcare team is there to support you throughout the rituximab treatment process. Don't hesitate to communicate your concerns or ask for assistance as needed. Rituximab is used for the treatment of various conditions, including 1. Non-Hodgkin's lymphoma. It is commonly used to treat certain types of non-Hodgkin's lymphoma, a type of cancer that affects the lymphatic system. 2. Chronic lymphocytic leukemia, CLL. Rituximab may be used in combination with other medications to treat CLL, a type of cancer that affects the white blood cells. 3. Rheumatoid arthritis. It is used to treat rheumatoid arthritis, an autoimmune disorder that causes joint inflammation and pain. 4. Granulomatosis with polyangiitis. Rituximab is used to treat granulomatosis with polyangiitis, a type of autoimmune vasculitis that affects the small blood vessels. 5. Pemphigus vulgaris. It is used in the treatment of pemphigus vulgaris, an autoimmune disorder that causes blistering of the skin and mucous membranes. These are just some of the conditions for which rituximab may be prescribed. It works by targeting and destroying specific cells in the body that are contributing to the disease process. The use of rituximab is determined by your healthcare provider based on your specific diagnosis and individual needs. Having a support person with you during your rituximab infusions can be very comforting and helpful. They can provide emotional support, help keep you company during the infusion, and assist with any needs you may have during the appointment. Having someone there to talk to, distract you, or just be a reassuring presence can make the experience less overwhelming. If you have a friend or family member who is willing and able to accompany you to your infusion appointments, it can be a great source of comfort. Make sure to discuss your needs and expectations with them beforehand, so they know how best to support you during the infusions. Having someone there to share the experience with you can help ease your nerves and make the process more manageable. Remember that it's normal to feel anxious about starting a new treatment, especially one that involves potential side effects like rituximab. Don't hesitate to reach out to your healthcare team if you have any concerns or questions. They can provide you with information, support, and guidance to help you feel more prepared and confident as you start your treatment. You've got this. I'm glad I could help address your concerns about starting rituximab treatment. Remember that you're not alone in this process, and your healthcare team is there to support you every step of the way. If you have any more questions or need further assistance in the future, don't hesitate to reach out. Take care, and best of luck with your treatment journey. Thank you for watching, and don't forget to like and subscribe for more videos on health and wellness. Take care and see you in the next one.